It was a great film. Long, long time ago with Jimmy Stewart. Jimmy Stewart. Was that pretty good?
It was okay. I knew who you were doing.
Thank you. I got a C on that one.
Yeah.
Mr. Smith Goes to Washington. I was forced to watch that in 8th grade and then loved it. And heaven knew that this year we should remake the film, Mrs. Uvegas Goes to Washington.
Oh, my goodness. Wow.
Linda Uvegas, CEO of City Mission. Welcome back.
Oh, it's good to be here, Brian. Thank you. That made me laugh. Mrs. Uvegas Going to Washington. That was good.
Have you seen the classic film years ago?
It's a great film. I loved it.
It's like a rite of passage in American government classes.
Yes.
That and 12 Angry Men. Everybody probably watches, right?
12 Angry Men.
What a great film.
Just one scene the whole time. They don't go anywhere. They're in a room.
And all of us want to serve in jury duty afterwards, and we want it to be just like that.
Right.
But it's probably not at all.
No.
So now, okay, you're CEO of City Mission, and for those, I can't imagine someone's unfamiliar, but maybe they are. What is City Mission again?
Sure. The City Mission, we've been in Cleveland since 1910, helping those who are experiencing homelessness. So men, women, and children, we have a long-term program to take them from that crisis to stability and closer to Christ.
Great. And are you ever full?
We're always full. Yes. Laura's Home, our women's facility. We have 166 beds. And yes, we are full. We've been full for years.
Isn't that wild?
It is.
I don't want you to be full.
Right.
Sorry, but I don't.
Right.
We don't want people experiencing homelessness in our community, and we certainly don't want a waiting list of people looking for help.
I know in a weird way, we need to work ourselves out of business.
That's right.
But then we'd have a new focus, whatever God would lead us to do next.
That's right. Now, somebody might say, oh, you're in Cleveland. Why would you go to Washington? Why wouldn't you go to Columbus? So why go to Washington?
Well, every year we have a DC forum. So that is actually put on by Citygate Network, which we belong to. So over 300 missions belong to this network. And they arrange a day, actually 2 to 3 days, where we're there at DC. We bring speakers in to talk to this group. There's about 100 of us this year of CEOs and COOs that go to Washington, and then we talk about what are the important topics and policies that we need to advocate for on the Hill for our own community. So we do a lot of learning, a lot of speakers, and then the next day are meetings with all of our representatives. So that was the purpose, and I see my purpose is to make sure that they know what is happening in Cleveland? How are we doing? How are we impacting our community? And what are some things and policies that we want to make them aware of? So we didn't get to meet with the individuals this time. I have in the past, but this time it was a very, very busy time in Washington with lots of things happening. So we met with the office of Senator Bernie Moreno, Senator John Husted, Congresswoman Shontel Brown, and Congressman Max Miller while we were there. So it was great to at least get them, make them aware of what's happening. And actually, some people say, you almost have better chances of that information getting to the representative by meeting with their legislative aide. So,
for sure. Because there's more work to do than they can possibly do on their own.
Right.
And for those who haven't experienced this, I think it's worth at some point in life going to Washington, not just to see the monuments, but I've had a few times with Moody Radio where we go to congressional and Senate offices.
Wow.
Any citizen can walk into the office buildings.
Mm-hmm.
Any person listening right now could go to Washington and go up and knock on Bernie Moreno's door.
Yes.
Hello, I'd like to meet with the senator. I know it sounds crazy, but that's how our country is designed.
Yes.
The only place you can't do that is the White House.
Right. Right.
And so you happened to go when it was a very busy time. And so, that's okay. But it's also, I think, uniquely wonderful in terms of in America, you can do that.
Right. I know. It was amazing to be there. I never take it for granted that we get to go and just walk those halls, and
it's amazing.
You see these names in the hallway. Oh, wow, that's so-and-so. And it's just pretty amazing. And also the history there.
Yeah, when I was a little kid, this is so random, but when I was a little kid, my parents took me to D.C. and we got a tour of the Capitol. And I remember Bob Dole was the Senate Majority Leader at the time.
Yeah.
And we walked past the office and all the doors were open back to where he was on the phone and he waved.
Wow.
And
Oh, that's pretty cool.
but that's, I mean, again, these experiences are so important. And,
Yes.
and being there, you're walking around seeing if you recognize anybody in the hallways. It's exciting. But you had a purpose there.
Mm-hmm.
You had a specific legislative goal that you're hoping for that'll help the people you serve here in Northeast Ohio. So can you tell us about this policy issue that's a concern to you?
Absolutely. So one real important point that we wanted to talk to our representatives and make them aware is this policy that was drafted in 1965, and it prevents Medicaid funds from being used for adults ages 21 to 65 in facilities that are providing mental health care and offering more than 16 beds. The policy restricts federal support for necessary behavioral health services, really leads to significant gaps in care for severe mental health and substance use disorders. So all that to say is, back in the 60s, 70s, there were these institutions of mental illness, patients, and it was not good. I think we've all seen movies or read stories of the horrific things that would happen. In fact, the person who drafted this bill, his sister in the 1940s had experienced a lobotomy, and he was so devastated by that and said, this has to change. This is not okay, the way those who are severely mentally ill treated. So they wanted to deinstitutionalize the mental institutions. And we know that because of that, many of those beds were eliminated and those hospitals were shut down, some for good reason. But there was no safety net for those that were left to themselves with no help.
Yeah, and it's a complex thing, right? Because you even heard about abusive husbands who would have their wives institutionalized.
Right.
It was very easy to do that back in the day. So the idea of getting rid of that makes so much sense, and I think it was good intentioned. However, you're right. If you empty America's mental institutions and you don't have another option for people who are struggling with mental health, they end up experiencing homelessness?
Yes.
Right? I mean,
exactly. Or being incarcerated because now they're on the street. Their behavior is unacceptable for society, and they don't know what to do with them, and so they now incarcerate them, which clearly the prisons, the jails are not a place to care for those experiencing severe mental health.
And we've talked about this at length, but it's worth repeating that if you have the idea that those experiencing homelessness or those incarcerated are just lazy people who want a free meal, you have a totally wrong view of it.
Exactly.
And all you have to do is go volunteer at the city mission or another organization for a couple of weeks to see that that's actually not true at all.
Absolutely.
People battling addiction, mental health, a crisis in their lives.
Substance abuse.
Yeah.
All of those.
That causes people to be in those desperate situations. So for those who don't remember as well, just briefly before a quick break, Medicaid is part of this. Can you remind folks, what is Medicaid? Because people confuse Medicaid and Medicare. Right.
Medicaid is what kicks in for those who are unable to have their own insurance. So those are the underserved. All of, I say many, if not all of our residents receive Medicaid because they need the medical care that they're not able to afford as you and I are. So Medicaid is critical for those services, especially for those that we serve, those who are experiencing poverty and on the low end of their income.
And this policy you mentioned from the 1960s, it prevents people from receiving Medicaid.
Exactly. So it prevents Medicaid funds for being used for ages at 21 to 65.
So lots of people
right
in a place like City Mission.
Mm-hmm.
right?
Right, exactly. That will impact them. So,
Because you have more than 16 beds or whatever the rule was.
right. So a hospital can only have 16 beds for those who are severely mentally ill. And obviously those beds, that's always full. That's not enough beds. And the goal was for the community to come around and provide the wraparound services. The goal was in the hospital, get stable, and then we're going to release you to a community-based organization that will continue that help.
Like City Mission.
Yes.
Or just like churches. The
Right.
idea was that the American people would surround them.
Sure.
And we're not.
But we're not licensed professional mental health workers.
Right.
So there has to be more mental health services to care for those. And we can maybe after the break, but we can talk about we think, how are we ever going to pay for that? Well, let me tell you, we're paying a lot already by the number of calls to EMS, the number of incarcerations, it just goes on and on. When somebody comes to the mission, they have to, or on the street, you bring, the EMS, the nurse, the fire truck, all those things. That's expensive.
A good point. Again, it's 6:49. With us, Linda Uvegas, CEO of City Mission. She was recently in Washington, D.C., advocating for the needs of Northeast Ohio. Specifically people who are battling various types of mental health and addiction issues that are people they serve. Mrs. Uvegas went to Washington recently, and she was advocating on behalf of those in need here in Northeast Ohio with our national representatives in the House and the Senate about a 1960s policy that prevents Medicaid funds from going to those who are not hospitalized, right, and are kind of experiencing homelessness. They need mental health care, but this policy excludes them from Medicaid, which would provide that care they need.
Exactly. It restricts the Medicaid funding, and there's just not enough to meet the need.
And so somebody would look at you, as you mentioned before the break, and say, well, yeah, but how are we going to pay for that?
Right. Well, I would suggest we are paying for it already. If you think about all the 911 calls, where people are on the street or mental health issues or an episode, that is very costly to the taxpayers. We are paying for it, and it's probably way less if we were able to provide the wraparound services that every individual, I believe, deserves because of their dignity. We've talked before, they're made in the image of God, every single person. So to have someone be treated that way, who has a mental illness, a severe mental illness, to not get the care that they deserve and need, I think is just horrific to me. And so we're talking to every single person we met. Please release those restrictions and do not exclude those severely mentally ill and these, the 16 beds. That's just not enough.
Yeah, and you can even think about the cost over time as well, where if someone doesn't get the mental health care they need, they're going to spend the rest of their lives being expensive to our community.
Exactly.
Through hospitalizations, ambulances, all those types of things, where the idea sounds to me like you're saying, release the restrictions, get them the care they need, and in theory, when they're better or properly medicated, they won't be a burden on society anymore. That's the idea, right?
Absolutely. And you're right, Brian, that long-term look. We can't just look for the immediate, because right now it's in the hospital, you got maybe 24 hours, 48 hours, get stable, get your meds, and now you're off. Well, that's not going to bring about change, and that's not going to really interrupt that cycle for that individual and get them the help that they need. And you also think of the strain on the hospitals. So that's fine. Okay, 911 is called, they go to the hospital. So can you imagine the strain on the hospital staff and what they are trying to also meet the needs of everyone? And this is a constant, revolving door for those who are severely mentally ill.
And for you, this comes from a place of your love for Jesus. And that's what I know about you. And this is why I get so excited about these kind of things, because there's no question that the Lord Jesus called us to care for those who are being oppressed and those who are poor.
Yes.
Right?
And
I mean, that's
yes,
over and over.
right. In fact, I'm actually reading through the Bible, I'm in Deuteronomy right now, and it's just amazing how God sets up, leave this extra for the poor, leave this so that they can glean and get what they need. He is always thinking about the poor and what is for them. So yes, I mean, we have to. I can't just turn my head and ignore that. With the Mayor Bibb is doing a lot of work on reaching those who are unhoused, and we're roughly about 250 individuals who are unhoused in Cleveland, living on the street in tents and so forth. Right now, they've housed about 120 of those. Yes, so they're doing good work, and they're finding places for them to stay. But they would say, and by their statistics, 90% of them are severely mentally ill. That is a concern. So where are the services?
Because if you don't treat the mental health issues, putting them in housing is going to do absolutely no good.
Right. That's not going to be sustainable.
90% have severe mental health issues.
Yes. We're not talking just, depression or minor anxiety. We're talking severe mental health issues.
And this touches my family personally, where I can speak to that, where my cousin, who I had every holiday with for all of my growing up years, is on the streets in Minneapolis with severe paranoia. I would label it schizophrenia, although I'm not certain if that is the clinical diagnosis. But it keeps him from living any sort of normal life. And there aren't many options for getting him the help he needs.
Yeah, that's very sad.
And it's heartbreaking. And so it's not like you have folks living in tents because that's fun in Cleveland.
Right.
A well-adjusted human with solid mental health care is not going to want to sleep in a tent in Cleveland.
Exactly. No, not at all. That is not, we've talked before, that's not like, oh, when I grew up, that's what I want to be doing. No.
Yeah, no one wants that.
Right. And I think if we don't see mental illness like if I were to break my arm or have something physically wrong, oh, Linda, go to the doctor and get help and get the care that you need. Of course. But mental illness it's hidden sometimes, but it's also stigmatized. Nobody wants to admit that. And then you're looked at a little bit differently, and yeah, I mean, that's unfortunate.
It's so true. If you pass by somebody in the city of Cleveland that's experiencing homelessness and they have an obvious broken leg, you're going to call for help.
Right.
But you're not going to do that if they have severe paranoia.
Right.
And can't take care of themselves.
Sure.
But although they need just as much care, if not more.
They do.
And it's that Christian heart issue of, I even think of that story in Scripture where Jesus is walking through a crowd and there's a guy yelling out, "Jesus, Son of David, have mercy on me." And everyone's like, "Be quiet."
Right.
"Shut your mouth."
Right.
"Leave him alone." And then Jesus goes to that guy. That's who he goes to.
Yes, exactly. Interesting. We were also looking as a team, looking at we're reading a book together, Pursuing God's Will, as a leadership team and having discernment. And when the blind man was healed and the Pharisees, "Oh, you can't heal on, this day or whatever, on the Sabbath." And then the parents, well, was he blind from birth? Oh, it's probably, they were asking all the wrong questions.
That's right.
They should have been rejoicing what Jesus had done, but instead they were asking the wrong questions. So I keep thinking to myself, are we asking the right questions when we are really looking to care for those severely mentally ill and those experiencing homelessness? What am I going to do? Blame them, or am I going to say, what happened? We talk about being trauma-informed care at the mission. We don't say, "What's wrong with you?" We say, "What happened to you?"
Yeah.
What happened? So we can know and we can love you and we can care for you and get the help that you need.
And it reminds me as well of a story of D.L. Moody on the streets in Chicago evangelizing, and somebody was critical of him. I don't like the way you're evangelizing people. And he goes, I like my way of evangelizing better than your way of not evangelizing.
That's good.
As in, we could debate about the best way to do it and not help anyone, or help people. Change a policy, help people.
Right.
Get the help they need. They're image bearers of the Lord.
Yep.
And I love that you all at City Mission, who take no federal funding, you're all donation based because you want to stay true to the gospel of Jesus Christ. You're advocating for those who need this.
Exactly.
I think that's super important.
Thank you. And it's really fun to go to talk to these legislative aides, or I've also talked to the mayor's office, and they always think I'm coming to ask for money. And I said, I don't want any of your money. I just want you to know what's happening. And let me tell you what you could do to maybe help us through policy or different ways. And it's so fun.
Because it's got to be shocking to them.
Shocked. You should see the look on their face. Oh, I'm used to people coming, ask for money and complaining. I said, I'm not here. I'm here to bring a solution, and I'm not here for money.
That's beautiful, because you're also saying essentially followers of Jesus have taken care of us. We don't need your money.
Right.
But we're here to help and partner with you to care for those who need it.
Exactly.
And
Yeah.
that's what the church is supposed to be doing.
I love it.
We love what you all are doing at City Mission. I love your heart. Again, this is Linda Uvegas, CEO of City Mission. She just went to Washington. There was no filibustering, but Lord willing, that your message resounded well enough with our senators and
Yes.
representatives that there'll be some policy changes to help those in our community.
Yep. Our follow-up is they will be coming for a tour. We're going to
Really?
work on, oh yeah, I don't have a date yet, but that's the plan. And that's where we really want to have them come on site and see what we're doing.
Well, then they won't be able to resist. I've been there
Exactly.
too, and I can't resist.
I know. I agree.
If folks want to volunteer or donate to City Mission, how can they learn more?
Sure. Go to our website, thecitymission.org, and everything is on there. What we need, what our greatest needs are, is maybe it's diapers or other items, hygiene items. And also, we just really appreciate meal providers. So if you have a small group or a community, something that, hey, we could do a meal at Laura's home, or for the men at Crossroads, we would greatly appreciate that. And it's a great opportunity to get to know who we serve and to be a blessing to many others.
Yeah, thecitymission.org, thecitymission.org. Please give Jamie Buxton a hard time for us.
Oh, absolutely. I'm going to see her after this.
Good.
All
Okay.
right.
And we can't wait to see you again soon.
Okay. Thank you, Brian.